So thank you for the kind invitation. I kind of defend both now. I defend the arthroscopic and the open surgery in comparison to electrocauterization. Well, when it comes to patellotendinitis, one of my old teachers told me, when you look at a pathology and you have a lot of methods, and really we do have a lot of methods, I think we have to regret that none really works completely. So I think it's important that we do need all these different approaches. So these are my disclosures. So the background, we say it's an activity-related disease which is related to jumping, and it is really a problem. When you see the numbers, especially in basketball, volleyball, male, predominantly to female, it's a real problem. And I think everybody who is involved in this type of sports is really bothered by this pathology. We have seen the diagnosis. I think it's important. We have seen the advantage of ultrasound. I think it is important both ways. MRI and ultrasound is important. You see the neovascularization, which is, I think, a sign of activity of the process, but still on MRI we sometimes see huge necrosis, and this is one of the issues why the study results are difficult to interpret, because we don't know exactly where we start from. So we have more or less necrosis, and I think we really have to see where we start from. And I think all these studies really lack a clear classification what's the problem and what's the right treatment then for that. So I think we all agree that first-line treatment really is the conservative approach, and again here we are very different methods proposed, and unfortunately it looks like not one works for everybody. So surgery is about 10% in this disease, and I think they all have a fairly similar approach, regardless if it's arthroscopic or if it's an open approach. It's the debridement of tissue, of necrotic tissue, getting some new vascularization, getting some new repair process engaged. I think this is the most important for a long-term success. You can maybe short-term succeed by just taking care of the pain factor, but the long-term success and the reduction of recurrence of this disease really needs to get rid of this necrotic tissue. So of course when we talk about surgery, we have to compare surgery to conservative treatment, and here there are only two studies really, the two prospective randomized studies. They start at the same time point. It's not like a second line of defense. They start at the same time point, and here they compare open surgery with eccentric training, and another one compares arthroscopic surgery with sclerosic injections. And here the first study, only 20 patients each group, prospective randomized, and they see there's really not a big difference between these two groups of surgery or eccentric training when you put them both at the same starting point. Also with arthroscopic surgery and sclerosic agents, you see there's not a real big difference. So these authors really conclude that the uncertainty of surgery is beneficial over therapeutic interventions at the time zero. As we say, surgery, as you will see, comes into place when conservative therapy has failed most of the time. But if the care at time zero, this is what you get. Yes, I do not like the right approach so much. I like the left one as well. But when you see the necrotic tissue in the tendon area, I think it's sometimes really important to get rid of this necrotic tissue. And as well, I have seen complications from arthroscopic surgery when half of the tendon is excised from posterior, which is sometimes more difficult to control when in open surgery. So there are, again, not many studies around comparing these techniques. This was a classic study in 2000, basically showing that arthroscopy is safe, or as safe as open surgery, not leading to better results, but it was safe, and it is about the same. These are two systematic reviews looking at open versus arthroscopic treatment. First one in 2013, you see 21 studies included in follow-up, and here really not a big difference, in minimal invasive arthroscopic surgery was not really better compared to a mini-open type of surgery. Again, all these studies have pretty low level of evidence. The other study, which has been mentioned here already, 2015, again 17 studies included. Again, when you look at the results, pretty much similar results, but which is interesting. Here you look how long the symptoms pursued until they went to surgery. And I think this is one of the biggest issues that hurts surgery, because we really do surgery when conservative therapy fails. And as I said, maybe to me, it's the effective of operation is then the patients are ready to take their break. Athletes don't want to take a break if you just rehab them. The coach don't want to have them take a break, and then they have surgery. They have a break, and that's probably maybe one success of the surgical procedures. But again, comparing arthroscopic versus open surgery, not really much difference, beside a quicker return to play. Again, in all of the studies, we do not know where we start from. And when we do open surgery, sometimes it's a big necrotic area and it's a big incision, which would be difficult to treat by arthroscopic surgery. So I'm not quite sure if we are comparing not apples and oranges in these studies, really. So all these studies do have the limitations: low level of evidence, very small samples, very non-homogeneous. They all have different post-op rehabilitation, and they do use different assessment tools and outcome measures. So what should we do? Well, the question is, we have to know the power of non-op treatment, and I think surgery is not as good as they can really recommend it from the start. I think it's a second-line treatment. We have to know all the limitations of the studies. We do not currently, I think, have the magic cure for patellar tendinitis, regardless how we approach it, and we really have to be aware that all these studies have pretty low levels of evidence, with very few exceptions. So arthroscopy with Square to open, as you say, it's safe. It's as safe as open. It's not safer, really. The postoperative outcome are as good as open surgery. High satisfaction rate, yes. Again, I think maybe it's the really break the athletes take and then the physio they do. It's maybe not always just the surgery by itself, it's just the more intense rehab they do. And yes, there is an advantage. When you look at the literature, the return to sports is quicker with arthroscopic procedures, and maybe even quicker if you just use electrocautery. Thank you very much.